I'm Kirsten Dorfert with Konica Minolta Healthcare. Today, I'd like to introduce you to a new capability with X-ray imaging, dynamic digital radiography, abbreviated as DDR, and also known as X-ray that moves. DDR is a low-dose X-ray imaging technique that enables visualization of anatomy and motion. It is a series of X-ray images acquired rapidly at either 6 or 15 frames per second. The images are viewed as a cinegram or movie and can be also viewed individually. The maximum acquisition time is 20 seconds, however, most studies are far shorter. The X-ray and motion images are acquired with a radiation dose that is comparable to a conventional X-ray exam and less than that of an average fluoroscopy exam or CT scan. Different from fluoroscopy, DDR is not real-time. Ideally suited for exams where visualization of motion is needed, but review can be retrospective in a very short time after the acquisition. Since it is not fluoroscopy, it can be scheduled and performed like a conventional static X-ray without requiring a physician to be present in the room. This greatly improves workflow and efficiency. The DDR system provides significantly more information than previously available using a conventional X-ray system. It provides the clinician the ability to observe anatomical and physiological changes over time, improving the quality and specificity of diagnosis. As seen here, DDR is useful for assessing diaphragmatic function pre- and post-surgery and other chest or pulmonary abnormalities such as pneumothorax. It has been used for contrast and non-contrast studies and has the potential to replace conventional X-ray, fluoroscopy, and other modalities for certain patient populations. DDR is currently available on several Konica Minolta X-ray platforms. A system with DDR is not dedicated to motion X-rays, but can also be used for static X-rays, providing significant operational efficiencies. In these images, you are seeing the MKDR mobile X-ray system with DDR capability. This is a solution only available from Konica Minolta. Having the DDR capability integrated in our mobile X-ray system allows this technology to be available for critical care patients at the bedside or anywhere in the facility where imaging is needed, aiding diagnosis, treatment planning, management of acute and chronic patients, and pre- and post-surgical assessment. New clinical use cases are emerging on a regular basis. Clinical cases for which DDR has been used in pediatrics include upper and lower GI, pulmonary, cleft palate, MSK applications, and line and tube placement. Elbow post reduction. As an example of DDR use in the emergency room, this is a case of an adult male who presented with a dislocated elbow, confirmed with conventional X-ray, as seen on the left. The patient was imaged with DDR post-reduction to visualize and confirm stability of the joint, shown in the image series on the right. Cleft palate evaluation. Clinicians in a large hospital in the Midwest routinely use DDR for all of their cleft palate surgery patients. DDR provides all of the dynamic information the cleft palate team needs to plan and evaluate the surgery. In addition to visualizing the anatomy and motion, DDR has the advantage of being much more convenient, scheduled just like a conventional X-ray, and acquired without physician presence. Gastroesophageal reflux evaluation. A 6-week-old infant presented with a history of recurrent vomiting. A swallow study with contrast was done using DDR dynamic imaging, as shown in the image on the left. Clearly visible in the image series on the right, acquired with DDR, is the patient experiencing gastroesophageal reflux that ascends all the way to the oral cavity. Colon patency evaluation. The medical team managing this infant was concerned about the patency of the colon and, as is shown in this dynamic image series, a lower GI retrograde contrast procedure was performed using the dynamic imaging capability of a Konica Minolta X-ray system with DDR. Endotracheal tube placement. A 2-day-old male patient with respiratory distress was intubated for increased support. The ET tube was not optimally placed, and the procedure to adjust the location was performed using DDR for visualization. In closing, DDR is the future of X-ray imaging, and the future is in use today at many sites around the globe. For more information, visit us at xraythatmoves.com.